having us. Again, my name is Latoya Hester, and I'm the Director of Communications at the Center for Black Health and Equity. And before we get started talking to you about this campaign that addresses misinformation as it relates to COVID-19, I want to introduce Shante Keith, who will talk to you about our organization, the work that we do, and how we're out here just saving Black lives every day.
Awesome. Thank you, Latoya.
Oh, wait, now let me just say though, before you get started, we are so excited that you all have joined us today, and we are both from the Black church tradition, which means we always expect a call and response. We love to see faces. We love to hear your voices. If you want to chime in, ask questions, participating with us is a big part of the way we engage as an organization. And so we invite you to just join us fully on the call.
Give me 1 second, everybody. Now I'm trying to do presenter view.
There we go. Now we can only see your slides.
It's not in presenter view though.
Oh, I see. I see.
So is there a way to, well,
You're trying to view your notes at the same time.
I am, but it's okay. Hey, it happens. So my name is Shante Keith. Thank you so much, Latoya, for the introduction. Shante here. I'm the Deputy Director for the Center for Black Health and Equity. So it's a pleasure. Thank you so very much for allowing us to talk to you today about the center and all of the incredible work that we are doing. So I wanted to just give a little bit of history about the center. We were actually founded about 20 years ago to address the disparate impact that tobacco use has on the African American community. And since that time, we have grown tremendously to address areas such as cancer and HIV, uterine fibroids, as well as COVID-19. But we really are an organization that helps communities really geared up and mobilized towards some level of policy change. And so one of the co-founders of the National African American Tobacco Prevention Network, he says, in many ways, NAPTN sets the standard for community-based advocacy related to tobacco prevention and control. The organization has grown and now anticipates a new era in health promotion and advocacy. And boy, was Dr. Bob right. Because in 2019, we just decided that we needed a new name that really spoke to all the things that NAPTN was addressing at the time. And so the Center for Black Health and Equity was born. And so we have the same mission, just different brand, look and feel, thanks to our brilliant communications director, Latoya Hester, and her team. So the mission is still the same. It is to facilitate the implementation and promotion of comprehensive equity-centered policies, community-led programs, and culturally competent public health campaigns that benefit people of African descent. And so again, we've grown. We're now focusing on these areas primarily, but we're also getting into spaces like mental health. We're also looking at programming around uterine fibroids, but these are really our main focus areas. Again, tobacco use, cancer, HIV, food and nutrition, equity-centered policies, as well as COVID-19. And so speak about growth, okay? I have been with the center for now 10 years. And when I first came on board, I was the first full-time hire that our executive director, Delmonte Jefferson, brought on board. And then we brought on 2 more staffers several years later, Latoya Hester, as well as Michael Scott. And so we were a team of 5, and we were cranking out a lot of work. But over the years, we have grown. We are now up to 20 staff folks, 5 consultants, as well as 31 strategic partners across the country. And so this is our wonderful staff. Right now we have, you see the picture is 19 folks on this picture, but we are literally doing orientation in the next room for a new policy manager that just started today. So our staff is all across the country. Just to note, we are headquartered in Durham, North Carolina. We also have a physical office in Cleveland, Ohio, but our staff is all over. We have folks in Atlanta, Georgia. That's where Latoya and our executive director are. We have folks in Florida, as well as Minnesota and in South Carolina. And so, if you all can see, as you all can see, we do a lot at the center. I'm just always mind-boggled by the growth of our organization. So again, when I first started, we had one signature program, and that was our CDC Tobacco and Cancer program. As you can see, we're now up to about 17 different programs covering those areas that I just talked about. And so how do we do all of this work? How do we, handle all of the programs that we have? Well, the center is really a network. We're comprised of tobacco and cancer control programs, faith-based institutions, community-based organizations, voluntary organizations like American Heart, American Lung, American Cancer Society. We also have African-American civic organizations like the NAACP and the Urban League. And we also have partnerships with higher learning institutions such as historically Black colleges and universities. And just to note, why we do the work that we do. We know that African Americans are disproportionately impacted by all the things such as HIV, such as cancer, such as heart disease, such as diabetes, sickle cell and the like, and even conditions that we don't talk about as often, like uterine fibroids, that tends to impact 80% of African American women across the country. So, our community-based organizations, we tend to, once we receive funding, we give a third of that funding to community-based organizations that are really on the ground doing this wonderful work. So I wanted to highlight one of those strategic partners, Ivanka Hall, who's with the Northeast Ohio Black Health Coalition in Cleveland, Ohio. When COVID-19 hit, we all had to pivot. So we were funding Ivanka to do tobacco prevention and cessation work in Cleveland. But because of COVID-19, she noticed that there was a gap in terms of children missing lunch because they weren't able to go to school. And so what she did was she launched Babies and Brunch, which is a wonderful initiative where she was packing up lunches in her house and gathering community members to deliver lunch to babies across Cleveland, Ohio. Another strategic partner of ours that I'd like to highlight is actually here in North Carolina. It's the Old North State Medical Foundation. 2 partners actually, Old North State Medical Foundation as well as Mount Carmel Helps. When COVID-19 hit, these 2 groups really went out into the community and they started to pull together food boxes and other necessities for folks. They distributed hand sanitizers and masks, but they also did COVID-19 testing, mainly in Eastern North Carolina, but they were able to service a lot of families during the beginning of the pandemic. And again, this is just another picture of our community member distributing food boxes, as well as the little girl who's a recipient of one of the boxes who was just so super excited that she was getting some food from our partners. So just to note, some of the other things that we do at the center, we do provide training and technical assistance for our strategic partners, for the CDC and other federal agencies, for faith-based institutions, really anyone who will listen, right? So we do training around community engagement, particularly really getting folks mobilized and hyped up to, first of all, raise awareness of these issues, but then get them mobilized and energized to talk to their elected officials to get some level of policy change passed. Along with the training and technical assistance, we also just show up. We try to show up at national, large scale events so that we can raise awareness among broader audiences, or larger audiences rather. Essence Festival is one of the largest events that we participate in, or that we have participated in the past. It looks quite different now because of COVID, but essentially this event brings about 500,000 people to the city of New Orleans every year. And I did say 500,000, I looked it up, I had to check. I couldn't believe it's that many folks. But that event brings a lot of folks to New Orleans. And so in the past, we've been able to disseminate messaging around tobacco use, particularly the TIPS campaign, Tips for Former Smokers through the CDC, as well as one of our other flagship programs, the PAC, Partnering and Communicating Together, where we disseminate messaging around getting tested and combating HIV stigma, as well as getting folks to get into care and stay in the care if they're a person living with HIV. This is another event that we typically participate in every year. It's the CIAA basketball tournament. It typically brings about 20,000 folks to their Fan Fest. Again, another opportunity to disseminate messaging from our key programs. And this tournament, it was actually around for about 15 years in Charlotte, North Carolina, but now it's in Baltimore, and we participated this year in February. So this is us at CIAA in years past. That's me listening intently to some young ladies talk about all the work that they're doing in the community. And I'm standing next to one of our senior program managers, Michael Scott. So I'm really excited about this slide. We also reach communities that are oftentimes hard to reach. This is a picture from a ballroom event. So we work really closely with the ballroom community, particularly to disseminate information around HIV, again, getting tested, really addressing the stigma around HIV, and also, again, getting folks into care and hoping that they stay in care. So the ballroom community it's a community that wraps around voguing and dancing. So what you're seeing right here is a competition where we've been able to really infuse some of the messaging in the competition. So sometimes the person will wear HIV prevention messaging and incorporate that into their costume while they're participating in the competition. So this is me and Latoya's baby. We also facilitate our own national event called the State of Black Health. We did the first one in 2018 in Atlanta, Georgia. This is a public health conference that brings together a diverse group of folks to really talk about things such as chronic disease. So we're looking at issues like diabetes and heart disease, sickle cell, mental health, but we're also having other conversations about things that really impact health. So we have a track around economic disparities, such as, wage gaps, employment discrimination, how those things impact health. We also have a track around social injustice, where we're looking at things like mass incarceration, racism, microaggressions, and how those things really impact our health as well. And so in last year, we were fortunate enough to have State of Black Health, but we did it virtually, which was really exciting. And we had guests like Michelle Williams, who is Grammy nominated and a former member of the group Destiny's Child. We highlighted mental health, which was a really strong panel. And that's certainly another focus area that we're looking to get into is mental health and behavioral health. So just wanted to briefly mention that these are the campaigns that we also promote, especially when we are out and engaging the community. We have campaigns like Bring Your Brave, where we're talking about lowering the risk of breast and ovarian cancer. I also mentioned tips from former smokers, which really seeks to get folks to stop smoking. We have our Partnering and Communicating Together program that really promotes PAC messaging, like Let's Stop HIV Together, or Doing It, which really asks folks to get tested for HIV. We have No Menthol Sunday, which is really our big awareness day that happens every May. It's actually coming up really soon, but it's a call for faith-based institutions across the country to talk about tobacco use, talk about cessation, getting congregants to stop smoking, but really amplifying the need for communities to take action on taking mentholated tobacco products off of our shelves, off of retail shelves, excuse me. We also have campaigns like the COVID Big Quit. I love this campaign. It talks about how smoking can weaken your immune system and put you at higher risk for severe illness or death from COVID-19. And I love this, you are irreplaceable, so make sure that you quit smoking. And then, of course, we have our Truth Check campaign that Latoya will talk more in detail about, but that's essentially about combating mis and disinformation on social media. I just also wanted to mention one of the ways we also engage communities is through our wonderful podcast, Black Body Health. This is another opportunity for us to raise awareness about some of the issues that are impacting the Black community, but also offer solutions on how to address those issues. And I also just wanted to say that we have tons of resources. Please visit the Center for Black Health.org. You'll see that we have tons of things for community members, particularly if they're looking for more information for these health challenges that tend to impact our community. So you'll see our public policy platform. I love the Power and Immunity Toolkit, which really talks about there's power in getting the right information around the COVID-19 vaccine. And again, this is just a list of some of our resources. We have the Health Justice Guide. We have a wonderful e-learning center where you can take different trainings and look at particularly, I think the one training that we have coming up is our tobacco prevention and cessation training that really breaks down this 5-part series about how to get, again, communities engaged in the tobacco control movement. We have No Menthol Sunday toolkit on our website, a capacity building roadmap that we provide training on. And again, Latoya is going to talk to you all about the Truth Check training. So I said all that to say that we are doing a lot. And because of the campaigns that we pull together, the social media engagement that we have, the training and TA that we provide, the wonderful partnerships that we have across the country and the large scale events, we are seeing really great results in terms of raising awareness, really building our brand as the lead authority on Black health, and of course, getting policy change across the country. So I hope that we stay connected. I'm going to turn this over to our wonderful communications director, Latoya Hester. But again, I wanted to just thank you all for giving us the opportunity to address you all today. Latoya, you're on mute.
All right, I was just trying to get my slides up. All right, well, thank you so much, Shantae, for introducing our organization. The crux of today's talk is all about spotting misinformation on social media and keeping it in check. This really is a fantastic campaign that we have been funded by the CDC Foundation to do. Now, here's the thing. I know that today I'm talking to librarians, and your life is all about media literacy in general. And so much of what I'm going to share with you today is not going to be new for you, but I do want to introduce you to the campaigns. I want to talk to you about how we talk to our publics about misinformation on social media, and maybe you can take away some of the style and some of the campaign resources that we have to share with your constituents and your stakeholders and the people who frequent the library system. And so I hope this will be useful for you. And I want to tell you just a little bit about why we chose this when we talk about COVID-19 vaccine hesitancy. So our organization, we are really committed to the idea that for ethnic minorities living in America, it can be dangerous. You know, it's difficult. The historical context under which we live and have been raised by makes some decisions more difficult, right? And so when it came to the COVID-19 vaccines, we knew that there was a great deal of hesitancy, but we knew that that hesitancy was legit. It was valid, and we didn't want to disparage anybody from being suspicious. There's countless number of examples. You know, ethnic minorities in this country have been obviously victims of scientific experiments. They have been forced into camps. I mean, there's all sorts of reasons for us to validate anyone's need for suspicion. And so what we have always said is that being suspicious will save your life. So be suspicious. But what we want you to do is go find the information that's accurate and that you need to make the best decisions for your health. So when we got this funding from the CDC Foundation, we decided that we were going to focus on helping people get the information that they needed through social media and not fall into the trap of misinformation. And so that's what this whole campaign is about, helping people become more literate when they're on social media, to know what's right and what's not quite right, and to stop sharing bad information to their friends, their family, and their followers. We always start here. You know, misinformation spreads really quickly, just like a virus, right? All right. So today I'm going to give you this quick crash course. All right. It's helpful for me to see your faces and you'll understand why in just a little bit. One of the things that I always say when we get started with the whole idea of truth checking or fact checking information is that if you can't remember a single one of the tips that I give you today, we really just want you to be in the good habit of giving the side eye. Now, how many of you guys are familiar with the side eye? Okay, good. We always define the side eye for people who are not quite sure what it is as a concerted look of suspicion. It kind of looks like this. Can you guys do it? Can we get the side eye looks? I see, I have a couple up. I saw something. No, that's rolling your eyes. Christy, that's rolling your eyes. That's not the side eye. You got to give it the side eye. Like, up. Yeah, there we go. That's what I'm talking about right there. So here's the thing. A lot of what we're talking about today is really just about taking a pause, just taking a beat to look at everything that you see on your timeline as perhaps suspicious before you share it. We are going to talk today a little bit about the key questions that you should ask when we're thinking about fact checking. We're going to talk about lateral reading, reading beyond the headline, doing a reverse image search, and then of course, a little bit of self-control with that click restraint. So these are the kind of tips that you would learn if you were going to go through a full out training. I'm going to give you sort of a condensed version today, but the whole idea, the whole point of the campaign is to get people to be like, no, I'm not sure I'm going to share this today. Right? And so if we can accomplish that, we've done a lot. But first, starting with the questions that people should ask. First, who created this content? I know this is not new for you guys, but we always ask people to say, listen, is this coming from a real doctor or a doctor who plays one on TV? Is this like one of the Shonda Rhimes doctors, or is this an actual doctor? If this information is related to children, is this information coming from a pediatrician or is it coming up from a podiatrist? We want to get people in the habit of just asking the question, who created this content? The next thing we always want them to ask is, what evidence is there to support what's being said? So as long as you're seeing content and then you can verify that it came from a real place, find out if there's more than one person saying that thing. Ask who is sharing it, where does it come from? If there's more evidence that supports this same exact conclusion or message, and find out what the other sources are saying. These are fact-checking essential questions. I did not make them up. And so we always talk to youth and teens and young people, our families, our aunties, grandma and them who be out here on the group chat, just sharing information that's not quite right. You always want to ask these questions. I know I had to ask my own mother several times. Like, I remember when the pandemic first started and she was sending me all kinds of information, the whole family just texting everybody about hot water and lemon was going to cure COVID. And we didn't have to worry because we just needed to get some hot water and lemon. And the first question I asked is, yo, mom, where'd you get this from? Did you find this on the CDC website? Like, let's make sure we have the best information, that we're asking the right questions about the information that we see. So when it comes to the skills, we talk to our audiences about lateral reading. And I don't know if this is something that you all discuss when we're thinking through like social media literacy concepts, but really we want people to stop scrolling down all the time. When you're looking at an article that you may see online, lead you to an article, and your instinct is to scroll straight down and read from top to bottom. We want to get people to start reading from side to side. That means that as whenever you're seeing the author, I want you to just go ahead and Google the author, open up a tab right next door and find out who the author is. I want you to click on the links that are available in the article, but I also want people to just start Googling phrases, Googling those conclusions, Googling the sources. And so in that way, you're not just reading down your screen, you're literally opening up tabs and you're reading across your screen because you want to verify what you've seen. So in this example, of course, NPR is a credible source. The headline says, new studies find evidence of superhuman immunity to COVID-19 in some individuals. And you can see that in my example here, I've opened up tons and tons of other sources. We've got Rockefeller University, the Wall Street Journal, CDC, and I'm basically going to read across the screen and I'm going to verify what I'm reading. And that's called lateral reading. And that's the way we explain it when we're working with our groups. The next thing we always encourage everyone to do is to read beyond the headline. I mean, the fact is, most people in this generation, we know what clickbait looks like under normal circumstances. But when it comes to COVID-19, some things that are kind of clickbaity-ish, we're not quite sure if it is clickbait, it kind of seems legit, it seems really credible. So if you look at this example here, it says Cleveland Clinic study, natural immunity as effective as vaccination. You've got this image of this guy, he's torn off his mask and he's free. And this is an older post, but the point is, right off the bat, it sounds like it comes from a legit source, and that is the legitimate conclusion of that source. But at the end of the day, if you don't read the article, you won't discover that Cleveland Clinic is really saying in this article that the research is showing that you should get vaccinated. In fact, this particular post got so much traction that Cleveland Clinic had to put out a whole statement that says, listen, people, we want you to get vaccinated. So the point is, you've got to read the whole entire article before you're quick to share it. And that's really what reading beyond the headline is. Read past the headline, right? Another skill that we teach, which is available in our online course, is the reverse image search. Now, a lot of young people are accustomed to doing this, but because social media is attracted to folks across generations, they may not recognize that a lot of times images that we see pop up on our feed are not brand new images. This particular post implies that this is a city in China with a bunch of people who have died on the street. And, it's written just to say, hey, Islam, Allah is always watching. And, there's this plague that has come upon China. And it looks like all these bodies are just dead in the streets in China. But the fact is, this is actually an art exhibit. This was actually an art exhibition that was done in Germany years ago. And they've just grabbed this photo and stuck it into a post, and it's unrelated. And so what we want people to get in the habit of recognizing is that sometimes those images that we see, you might want to fact check those too. Now, this is not the last skill that we teach. There are several others that we teach in the course, but just for the sake of this conversation, the last one that I teach is click restraint. When it comes to click restraint, this is all about self-control. And one of the things that I always have people do when we're doing these trainings is I say, okay, I want someone to write in the chat box, because sometimes this is done virtually, sometimes this is done live. We say, someone in the chat box, type in www, yes, I said it, www.clickonthis.com. And lots of people will start, putting the click on this, click on this, click on this. And then I say, okay, everyone stop. Now I want you to take a deep breath. I want you to take your finger off the trackpad. Do not keep your hand on that mouse. And I just want you to hold, and just don't click on that. Click restrain. Just restrain from clicking. That's all you got to do, because we know that every time we click on content, even if it looks really compelling and we just want to know what it says, we're feeding the algorithm, right? We have to help people to remember that every time you click on something, or you like it, or you comment, or you just want to share it because it's outrageous, it's telling the social media platforms that this information is useful or good or interesting, and it should be spread further. And we want to actually prevent the spread of bad information. So we say, listen, if you can't do anything else, give it the side eye and just don't click on that, right? Just don't click on that. And then we talk about everyone and their friends. This is a really important point that I always try to make. People will report that they do not trust social media. They don't trust what they see on social media. But the fact is, they trust Christy, they trust Amelia, they trust me, Latoya. I'm their daughter. I'm their friend who works in public health. I am this librarian. I am a credible source. So if I post something on social, even though my friends and family don't trust social media, they do trust me. And they might not know that I'm out here just trying to get clicks and likes because I'm having a bad day and I just need a little ego stroke. They may not know that I've just posted that for that reason. They may not know I posted this because I felt like this was outrageous. If I didn't say specifically, hey, I'm posting this because it made me mad. If I just post it, assuming that everyone's going to realize it's ridiculous information, I can't do that. Your friends are trusting you. You are a credible source to somebody. That means you've got to be really responsible with what you decide to put out there. Because the fact of the matter is, when people see content on social media, it can change the way they make decisions for their health. As a marketer, I know I come from the industry of people who we sit in the room and we think about how we can craft a message to make people laugh so they won't notice that we're really trying to get them to buy, or to vote a certain way, or to adopt a certain belief or attitude about something or someone. We know it's effective and that it works on the advertising and marketing side of things, because we know companies spend billions of dollars changing everyone's mind, and they do it through social media. I know everybody else thinks they're not gullible and they're not going to fall for it. Doesn't apply to them. But here it is. If you think it doesn't apply to you, then you will not build up the safeguards to prevent yourself from becoming a victim to bad news, to bad information. And you will inadvertently spread it to your friends, your family, and your followers. So I always take a pause and say, remember that you're a credible source and we just got to do better. Amen. Amen. All right. I'm going to show you a PSA that we use to promote the campaign.
Listen, there's so much misinformation on social media out there. And when it comes to COVID and the vaccines, before you share, give it the side eye. It's cool to be suspicious sometimes. Ask where the info came from, when it was first published, and if it's accurate. To get more tips on how to truth check your timeline, go to truthcheck.org.
And you too can go to truthcheck.org to get that information that we talked about. When you go there, you will find, we're actually building this campaign right now. So if you go there, you'll find a little bit of information around media literacy, but we're adding information every day. One of the things that you can find when you go there is information about how to report misinformation. This is really important because our organization is all about advocacy. It's one thing to change your personal behavior, but our organization has never really been about personal decisions. As an example, our organization has been in tobacco prevention for decades, but our goal has never been to get people to quit smoking. Our goal has always been to get the industry to do right, the tobacco industry to do right. And so the same is true when it comes to things like social media advocacy. So what we want people to realize is that Facebook and Instagram, well, Facebook owns Instagram, but all these platforms, they are in a tug of war about whether or not they should do the right thing or increase their own engagement, because engagement gets them the dollars, right? That's like literacy 101 when it comes to social media literacy. And that means that they're not always going to take down information that doesn't serve society. They're just not gonna. They're gonna say they did and then they don't. Because we already know that whistleblower came out and was like, yeah, they pretended to take down 20 million pieces of COVID-19 misinformation, but that's because of the pressure to do so. And we're pretty sure they didn't do that great of a job when they were at it. So we can't leave it to the platforms to do the right thing. We ourselves have to be committed to doing the right thing. So if we see misinformation, there is some stuff that we can do. Number one, these platforms have allowed you the option to actually report misinformation that you see that looks suspicious. So whenever you see a post, you click on the 3 dots and you can find support or report the post. That's also true on Twitter. One of the things I really like about Twitter is that if you have an article that's up and you think you're going to share it with all your friends, family, and followers, and you're not going to read it, it's going to be like, boop, sis, did you read this article? And it's just going to pause for you to think about the fact that you're about to share something that you haven't even read. Did you read beyond the headline? Did you give it the side eye? Did you even look at this? So Twitter is doing that. I love that feature. Facebook allows you also to report posts. But if you go to thetruthcheck.org, you can see a quick little download that'll give you that information. It also points you to the World Health Organization. There's a really great how to report misinformation that website offers as well. So we always point people there during our trainings. Now, we always end our training with a little bit of side-eye practice. Requires group participation, but don't worry, I know you already got your eyes ready to go. So when we see information that looks questionable online, so for instance, this one, hundreds and thousands died after taking the advice of these celebrities who are aiding and abetting mass murder by advocating COVID-19 vaccination. If you cannot remember what we said about reading beyond the headline, and if you can't quite remember what it means to do your lateral reading, what I want you to do is just what? Give it the side eye, right? We have Oprah here to help us because she just definitely knows how to give a good side eye, doesn't she? All right, if Candace Owens posts something like the CDC actually put together a document to discuss putting high-risk people into camps to shield low-risk people from them, listen, we could look this up. We could spend our time looking it up, or we could just give it the side eye, right? We could just give it the side eye and not share that information. If Nicki Minaj put that information about how her cousin got the vaccine and then came back with swollen testicles, we're going to be like, well, Nicki Minaj, you sell millions of albums making music, but you're not necessarily the most credible source. What are we going to do? We're just going to give that the side eye and we're going to leave that alone. We're not going to share it with everyone for them to get all freaked out about information that has not been verified. We're going to remember to ask those good questions. We're going to remember to give it the side eye when we can't remember the good questions. And if you want to learn more, you can go to thetruthcheck.org where we walk you through an interactive training. And I hope that you guys share this with your folks on your websites so that they can go get a little bit more literate when it comes to engaging on social media. One of the coolest parts of this particular campaign is that we've been able to partner with Jennifer Lewis, who is considered the mother of Black Hollywood. You may know her from Blackish and a myriad of other roles. I think she became famous from Fresh Prince of Bel-Air back in the day. But she hopped in on this with us, and I don't know if you have seen her social medias lately, but she gets on there and she does these songs. So now even people who are like Gen Zers and young millennials, they even know who she is because she's, auntie. She's everybody's auntie. So I'm going to leave you with her song that she did for us.
Truth check your timeline. Give it a side eye before you share. There's a lot of misinformation. So don't just like you don't care. Read past the headlines and go directly to the source. I went to the thetruthcheck.org. I took the course because they're targeting us. A lot of fake news. But finding the truth is what I choose. 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 Just the facts, ma'am.
We always get a great kick out of her. She's done a few postings for us, and we're so grateful. If you're interested in learning more about the Truth Check, go to thetruthcheck.org. Again, I'm Latoya Hester, the Director of Communications at the Center for Black Health and Equity, and we're so grateful that you've invited us to be a part of the conversation today.
Thank you so much, Latoya. I loved that song. That's amazing. I'm just like play that.
Fun, right?
Yeah, so we do have some time for questions. If anyone has questions about the Truth Check or what the center is doing more broadly. I know that when folks registered, there were a few questions they submitted in advance. So
okay,
if the group doesn't have any, I can ask some of those.
Yeah. No problem. So you should know, though, that Shantae has headed up our programs for years, and so she may be better to answer some of them, but I'm pretty sure I can handle it. Lay them on me. She had to escape because she's onboarding a new person today in policy.
I wanted to ask, what are some ways that libraries can partner with what the center is doing? I know Shantae had mentioned a few programs and things. How can we get involved?
So one of the ways that you can support this particular campaign is to help us to promote the Truth Check training. We are excited that we'll be able to continue with this campaign for another year. And so we're going to want to start distributing materials that you can use and point people to the training. When it comes to our other programs and projects, one of the things that we always need are opportunities to speak to the public. So we know that the public library system is usually a platform where you have space where our community partners can meet who live in the area. I think you can usually do that for no cost here in Atlanta. And remembering just certain best practices around health disparities. And so we know that education and literacy is a huge factor when it comes to eliminating disparities. And so making that a major part of the conversation as an association is already doing a lot. You know what I mean? Like just recognizing that the station of libraries is so important and making that a part of the equity conversation is actually one way that you can help us in general, in the whole fight for equity in general.
Looks like we have a few questions in chat. So Retha asked, how do you reach out to Black churches and other organizations?
So a lot of our partners have faith-based programs. The major faith-based program that we have is No Menthol Sunday, and it's all around, it's our National Observance Day that is focused on getting churches and faith communities to talk about tobacco use and the role of menthol in the Black community. We do this so every year, May 15th, we have No Menthol Sunday happens. So I meant to say that on April 1st this year, we're going to release a toolkit. In that toolkit, churches can download it and they can find ways that they can, we do church announcements in there, sermon topics, fact sheets, things for youth to do, all kinds of activities that you can use in your church. But we work with coalitions statewide to get that toolkit in the hands of faith leaders. It's an interfaith effort. And usually what happens is either a state health department has the charge to reach out to Black communities, so they take interest in No Menthol Sunday. We also work directly with the AME church denomination as well as the Kojic church denomination, and we make sure that the toolkit gets out in their hands. We work with Balm and Gilead, which is a faith-based organization who focuses on any church that has a health ministry. So we it's really through the partnerships and the networks that Shantae mentioned earlier is how we reach churches. And we always have when it comes to the Black church, we always have an ongoing debate in our organization. You have the camp that says, oh, we need to focus on the mega churches because they have more resources to reach more people. But I'm on the other camp, which is we need to reach what I call dirt road churches, which the CDC can't seem to necessarily get their messages around cessation, quitting smoking, all that. That message doesn't always get to folks who are very transient because they're being pushed out of their, moving all the time with rent or with evictions or just looking for work. They're very transient. They may not have internet access as easily. So we are all about our on the ground community navigators. A lot of coalitions have those community navigators that go door to door and they say, hey, get your church involved. And we go that route too. So we do all of the things that we can. We kind of leverage our own lives. I mean, we're all Black people. So we just go where we go. We go where we are. Because on Menthol Sunday, all of us be at our church, and by the way, right? So.
And a question from, my chat. I'm not sure. So someone on an iPhone, they would love to share some information on their library website. So are there shareable videos, maybe from Truth Check? What do you suggest in terms of sharing to the public?
So I can send you, I'll send you links, and I'll also send you our Instagram where some of those videos live. And we're trying to get all the videos onto the website, but you should be able to put them directly there. I mean, anything we have, we would want you to put out there. Anything we have. So there's no asking permission. If you see it, we want it to get out there. So I won't share the direct slides from today's presentation, but I'm happy to share those individual videos.
Okay, great. Yeah, and this presentation is being recorded and I'll share with the NC Live community. So it may be a little bit more librarian facing, this presentation. But you're welcome to share that with your libraries to view this recording and learn more about it.
Yeah. That's great. And you all are really just the perfect audience, to be frank. I mean, a lot of what we do, almost none of what we do as an organization is for and directly to general public. In fact, the Truth Check is one of the first times we've ever done anything for the general public. We try to reach the leaders, those who have stakeholder groups under them. So any kind of an association is the exact audience that we want. We know that you can translate that information for your audiences. So thank you so much for having me today.
Thank you so much, Latoya. And pass on our thanks to Shantae as well. Really appreciate her being here. And as I mentioned, this is being recorded, so I'll share it out afterwards. And yeah, I thank you all for being here. Thank you again, and enjoy the rest of your Wednesday.
Thank you so much. Bye-bye.
Thank you.